Hello, my name is Edic Stephanian. I'm a vascular surgeon. I've been in practice now for 29 years, and I'd like to share with you what I've learned over the years. I just feel at this point in my life where I'm getting towards the end of my career, it's better to share information that I've learned over the past 29 years rather than just retire and have all those years wasted. So my goal is to educate you on vascular surgery and help you navigate the system, because I don't think it's very well understood at all by most lay people, and also, unfortunately, most primary care physicians and internists. So what is vascular surgery? Vascular surgery is the surgery of blood vessels. It's the surgery for blockages and other issues that may cause limb or life-threatening issues. The difficulty with vascular surgery is really not knowing when to operate. It's knowing when to not operate. And I think that's one of the things I'd like to stress is there's way too many procedures being performed that are not necessary. So over the past 29 years, my way of working up and handling patients has changed as technology has improved and as we've gained more knowledge in vascular surgery. I'm going to try and divide these videos up into separate segments. The first topic I'll discuss tomorrow is how to work up leg swelling issues and evaluate these kind of problems, because there's a lot of patients with leg swelling issues and really nobody wants to take care of them. And they're mostly non-operative cases and people just don't want to deal with it. It's not considered a issue that's bothersome to vascular surgeons and other specialists, but it actually does affect a lot of patients. And so I see a lot of people with with limb swelling issues because other people just don't want to see them. And so I'd like to convey to you what I've found in my own experience with these problems. And then we'll talk about other issues that I think are important. I'd like to have the opportunity to answer some of your questions. Obviously, I can't get into specific medical consults and recommendations because of the nature of video and the public forum it's on, but I think I can provide you at least with some direction as to which way to go in terms of working up these issues. Just as background, some of the things that we deal with are, things that are quite dangerous, like aneurysms that can rupture and are rapidly fatal if not handled correctly. And it can range from that to something minor like limb swelling issues. We deal a lot with diabetic problems. We deal a lot with kidney problems and strokes. And most of what we see is very repetitive. And I find that most patients are not really served well by the current evaluations that are done. And so I'm glad to help in any way I can. Again, this is my way of kind of giving back, because I have had a wonderful career. And as I see myself going towards my retirement, I think about how I can not retire, but really kind of use my knowledge and my experience to help others. Anyway, tomorrow we'll talk about limb swelling issues, and I'll try and give you a broad overview and again answer questions that you might have about it. Thank you.